An alarming and little-known illness is spreading through air conditioning systems. New York. In recent weeks, air conditioning has proven to be a crucial relief for many Americans grappling with oppressive heat. However, in certain areas of Upper Manhattan, the pursuit of cool air has tragically resulted in illness and fatalities. Within the cooling towers of nearly a dozen apartment complexes, bacteria have thrived due to inadequate maintenance. As large air conditioning units circulated cool air into living spaces, these harmful bacteria rode the warm air currents back into the atmosphere, affecting the Harlem skyline. Since July 25th, at least 67 individuals across 5 zip codes have inhaled this bacteria and subsequently developed what is known as Legionnaires' disease. Out of these cases, 24 people required hospitalization, and 3 have sadly lost their lives. This outbreak marks the largest in New York City in the past decade, and health officials are bracing for an increase in cases. In response, city workers have conducted tests on all cooling towers within the affected zip codes and have treated those found to be contaminated, as stated by Mayor Eric Adams in a recent video update. The rising threat of Legionnaires' disease. Legionnaires' disease was once a rare occurrence, named after a group of veterans who fell ill during a convention in a Philadelphia hotel in 1976. However, in recent years, its prevalence has surged across the United States, as reported by the U.S. Centers for Disease Control and Prevention, CDC. Since the year 2000, there has been a staggering 9-fold increase in cases, with research indicating that rising temperatures and humidity levels due to climate change are significant contributors to this trend. Jean Grassman, an associate professor at the City University of New York Graduate School of Public Health, explains, "When you have extremely hot conditions, our infrastructure struggles to keep pace. People are beginning to realize that whether it's floods or cooling systems, they are not built to handle these extremes. The failures we are witnessing are not surprising." The bacteria responsible for Legionnaires' disease, known as Legionella, flourishes in water temperatures ranging from 77 to 113 degrees Fahrenheit. If buildings do not maintain their cooling towers properly, the water can become a breeding ground for this dangerous bacteria. In late July, the Northeast experienced several days of intense heat and flooding, which led to increased air conditioning usage, likely exacerbating the outbreak. Understanding Legionnaires' disease and its risks. Legionnaires' disease derives its name from the aforementioned 1976 outbreak, where over 180 individuals contracted the illness, resulting in 29 deaths. This disease manifests as a severe form of pneumonia and is not transmitted from person to person. Instead, it spreads through inhalation of contaminated air or water droplets, which can lead to clusters of infections. With timely diagnosis, Legionnaires' disease can be effectively treated with antibiotics. However, its flu-like symptoms are often overlooked until it is too late. Historically, outbreaks have predominantly affected lower-income and non-white communities. The current outbreak in New York is centered in central Harlem, a neighborhood with a significant black population. The city previously faced its largest outbreak in 2015, linked to a single cooling tower in the South Bronx, resulting in 138 cases and 16 deaths. In 2022, another cluster of 30 cases was reported in the Highbridge area of the Bronx. Dr. Tyler Evans, a former health official in New York City, noted that Legionnaires' disease tends to fluctuate between the Bronx and Harlem. He remarked, "Like many infectious disease outbreaks, there is a tendency to affect historically marginalized communities, particularly black and brown populations. These communities often experience higher rates of chronic health issues, such as asthma and chronic obstructive pulmonary disease, which increase the risk of severe illness if they inhale the bacteria." Dr. Michelle Morse, the acting health commissioner for the city, emphasized that older adults and individuals with chronic lung conditions or who smoke are also at heightened risk. She urged residents in the affected zip codes to remain vigilant to the symptoms and seek medical attention if necessary. The health department encourages continued use of air conditioning, including window units and other water-using appliances. Dr. Barun Mathema, an associate professor of epidemiology at Columbia University Mailman School of Public Health, stressed the importance of maintaining infrastructure like cooling towers to prevent future outbreaks. We designed and built these systems. It is our responsibility to ensure they are properly maintained, he stated. Eduardo Cuevas is a reporter for USA Today based in New York City. You can reach him via email at mcuevas1@usatoday.com or on Signal at mcuevas.01.